at My Best Friend Veterinary Center, we do perform multiple surgeries weekly. If your pet has been here recently for spay, neuter, mass removal, anything that your pet is going home with an incision, this is some of your at-home care instructions. We will send you with additional information, so be on the lookout in your bag that we send you home with medications. Your pet had surgery today, so we did go under general anesthesia. With that being said, your pet will probably be quite sleepy tonight, a little tired. So when you get home with your pet, just make a nice warm spot, a nice comfortable cozy place for them to lay down and relax. It's okay that they're a little sleepy. It's very normal and natural. After a good night of sleep tonight, they will feel much better in the morning. When you get home tonight, you can go ahead and put water down for them. They might not be very thirsty. Remember, their little arm will be shaved because they had IV fluids today. So again, if they're not very thirsty tonight, that's okay. You can offer food tonight, and if they show interest, fantastic. If they do not, don't be concerned. If you offer a small amount, and let's say it did unfortunately cause a little bit of GI upset or tummy upset, and they did vomit, again, that's okay. Just wait, they're not ready, and wait until tomorrow morning for breakfast. Again, they're going to be sleepy, and that's all right. For the rest of this incision care, there's really some main things we need to focus on. The first thing is that e-collar. That e-collar is probably what you know as the cone of shame. That is very, very important. The more you leave it on, the less difficult it's going to be as a transition for you and your pet. That e-collar really should be on 24/7. Really focusing on those times where you're sleeping or your pet is sleeping or when you are not home. If your pet says they cannot eat with it on, that is okay. They usually can, but if they say they can't, that is the only time where you can go ahead and take that off. Please be present and right there, because sometimes even if they're hungry, they will quickly turn to try to lick their incision, which we're trying to avoid. So again, e-collar, step number 1. Step number 2 for caring for those incisions for your pets is going to be activity restriction, which is quite hard sometimes. If you left your appointment today and we sent you home with a sedative, we will go over that with you. Your technician will also kind of address that. If you're at home and we did not send you with a sedative and you're feeling like, whew, I think we're being a little too active, please let us know and we will provide you with a sedative. It's just a phone call away if you think you need that. So really those first 2 big things, e-collar and activity restriction. Activity restriction, we really mean no jumping on and off the couch, no running up and down the stairs, no zoomies, and no chasing squirrels in the backyard. So if you do have a backyard, please leash walk as well in the backyard so we can't run and play, okay? That activity restriction really needs to stay in place for 10 to 14 days for incision healing time. And then thirdly, all we ask is that you check those incisions twice a day. Please do check them twice a day. What you're looking for is significant changes in swelling or discharge. If you see either one of those, never hesitate to call us, let us know. You can also send a photo via email, and we can always discuss if you need to come in, if we need to recheck sooner, but otherwise we recheck those incisions in 10 to 14 days. Now, some of your incisions will have sutures, some will have external staples that need to be removed, and some of those sutures will all be absorbable and there won't be anything to remove. But again, if you see any suture, and we will let you know what kind of suture you have placed or staples. If you see anything that's concerning, again, 10 to 14 days, those are removed. All right.